So I'm here. I introduce the group. If there's new members, we go around the table and just be sure that everybody's aware of the ground rules around confidentiality. And then from there, we usually have an educational component. During that time, I will see each of the patients individually in an exam room across the hall. So we take them out of the group visit, do an individual exam, and then at the end, I'll come back and answer questions that have arisen during the discussion.
So there's a physician, and I'm a facilitator and a childbirth educator. So the physician and I work together with the women in the group, and there's typically between 8 and 12 women in a group. Basically, the women are responsible when they come in for taking their own blood pressure, and they chart it themselves. We provide them with a binder that has all that information in there. They also do their own urine, check their own urine. They also will weigh themselves, and then after that they are seen individually, briefly by the doctor. It's all taken place in the same room. So they do that for the first half an hour or so, and the rest of the group is spent talking about topics that are relevant to their stage of pregnancy. So it's very patient driven. We allow the patients to, discuss and bring up topics that are interesting to them, and we just clarify any information. And that's how it's structured.
The group visit is called Ask a Dietitian, and the content is completely patient-led, so week to week it's completely different, whatever the patients want to talk about. So we have about 6 people, and it's a 90-minute class, and everybody gets an opportunity to ask their top 1 or 2 nutrition questions. And usually there's some common ground, so I have the opportunity to teach some basic skills like label reading that are applicable to everyone, but I do focus on each person individually and discuss their concerns. I have a chart note template that I use, and it just goes over the patient's main nutrition concern, what we discussed, and then any specific recommendation. So it's in a summary format, but it's easy and simple for the physician to read and look over. Patients can self-refer. They can be referred by any member of the multidisciplinary team or by their physician. And we have a great administrative staff person who does all the scheduling. So they would come to the class on the set day, and I introduce myself. They sign a confidentiality agreement, which just basically allows me to send a report back to their physician, and also, lets them know that they shouldn't share other people's personal information outside of the group. And then basically, I go around the room and just get everyone's questions and write them down. And usually that's when we identify that there's a lot of common ground. And then we just start a discussion. So it's very open and it's very laid back, so patients can add more questions or add their own thoughts or suggestions to other participants. So it's really interactive. Our model is based on the DIGMA model. Only the healthcare provider is myself, the dietitian, versus a physician.